DPS community or committee meeting. We'll start the day with pledge to the flag. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Can I get a moment just for questions? Thank you. Okay, start with the roll call. Legislator McNabb Coleman has been excused. Legislator Petcher is here. Legislator Bell is here. Legislator Winslow and myself. So we have a quorum. I need minutes to approve for the January 14th, 2026 meeting.
So.
I have a motion. I need a second.
Second.
All in favor?
Aye.
Any opposed? Carries. I have, just for informational sake, we have some appointments that will be brought at the current full lead meeting. 3 appointments for the Fire Advisory Board, Doug LaFave, Dave Perkins, and Andrew Rocco. So those 3 will be brought up at the full lead for approval at that point in time. With that, that brings me to department updates. Again, we're going to go a little bit out of order. We'll start with the district attorney, Brittany Ann from that.
Good evening, everyone. You have my very short report. Just one exciting announcement. One of our prosecutors, Mark Moody, did win the Morgenthau Award for the District Attorneys Association for the state of New York. It's one attorney every year out of each of the 4 regions in the state. It's the first time, to my knowledge, in Cayuga County history that a member of the DA's office has won that award in our county. So I'm very excited and very proud of them. So it's well deserved.
What's the award?
It's the Robert Morgenthau Award. He was a great district attorney out of Manhattan. Very long
performance
time.
And
integrity, ethics, doing the right thing.
Mhm.
So we're very proud of him. And other than that, I don't have any resolutions on tonight.
If you would, from the Judicial Public Safety Committee, congratulations to him and your office.
Thank you.
And a great job, well done, as always.
Thank you.
Thank you. Anybody have any questions for the district attorney? Comments? Thank you.
Thank you all.
Next up, we'll have Denise Spangler from 911.
Good evening. You have my report. Just a couple of things to touch on. Staffing. We have 2 new staff members. So we're at 4 fairly new hires right now. 2 are call taking, and then 2 have just started the call taking process, learning kind of the dynamics of call taking. With respect to, we'll still have 2 vacant dispatcher positions that we'll probably hire sometime maybe April or May. But we've got to get these 4 through, just because it'll get congested in the center with too many trainees. I did send out my annual report if there's any questions on that. And then in respect to the backup center, we did meet with Beardsley today to review the design. Still a few things to clean up on that. The fiber connection from AFD to Osborne will be done next week. And the new UPS at Osborne will be installed in the next couple of weeks, so we can start moving some of that equipment from the current backup center to the Osborne site. And then hopefully sometime in early April, we'll start moving some of the server equipment, the Motorola equipment over to Auburn Fire. And I have 2 resolutions.
Yeah. First one, JP1, authorizing the chairperson of the Cayuga County Legislature to enter into contract with Motorola Solutions, Inc. for upgrading the next generation 911 telephone system for Cayuga County 911 Center.
Yep, so this is the new phone system. This is 100% grant funded, no state match, or excuse me, no county match. And we are partnering with Oswego County on this. We're going to build fiber out in between each county to support one another for disaster planning.
Just a question. So if that's the case, and I'm assuming we're going to be able to talk back and forth center to center, correct?
So we can right now on the intercom from Motorola, but I mean, we would be able to pass calls back and forth from one another.
Well, my next question would be,
Yeah.
so if our center for whatever reason goes down, can we dispatch from that situation or no?
We could. It would take some other logistics just because of the radio system as well. But down the road, yes, that's our plan.
Okay,
And
that's,
there's still some other nuances, but the plan is that we would be able to go there and log into our phone system and take calls from Cayuga County.
that in the future would be a great upgrade for
Yeah.
our system.
You got it.
Perfect.
And you do that if both systems went down here?
Yeah, so if we went down, we would be able to go there and log in and have all of our templates on our phone system and be able to take calls like we were in Cayuga County.
Oh, you couldn't do it at the backup center?
Oh, yeah, we will be able to do it,
Right.
of course.
Oh.
Yes, yes.
This would be only if
This
both
is like a
systems.
scary plan.
Okay.
You got it. Yes.
I guess we got a little bit ahead of ourselves.
Yeah, I'm sorry.
No, that's fine. So I need a motion for JP1.
Move it.
I have a motion second. Tom, you good with that?
Yes.
Perfect. We've had some discussion. Anybody else have any questions about JP1? If not, all in favor?
Aye.
Aye. Any opposed? Carried. JP2, authorizing the chairperson of the Cayuga County Legislature to sign an agreement with Interaction Insight Corp. for the purchase of a new Eventide backup recorder, QA A1 or AI services upgrade for the backup.
Move it.
I have a motion. I need a second.
Second.
I have a second. Any discussion? Hearing none. All in favor?
Aye.
Any opposed? Carried. Anybody have anything else for the 911 director? Thank you, Denise.
Thank you.
Next up is assigned counsel. John, I'm sorry. Last name. Price. Right, John Price. Thank you. I apologize for that.
Oh,
So,
no problem. Good afternoon, everyone. Have a report, not much out of the ordinary. Just worth noting, as was discussed there, we're currently working with New York State with Indigent Legal Services. There's a grant available, a family court program. There are some conditions on how that money can be used. We're working on a plan that could best benefit attorneys for clients, and I'm hopeful could help with our budget in the long run as well. So hopefully the next time we're here, we'll have more to report on that. Otherwise, if there are any questions.
anybody have any questions for Mr. Price or assigned counsel? Hearing none. Thank you, sir, very much.
Thank you.
Yep. Next up would be the coroner, Dr. Duckett. I don't see him on the computer and obviously not in the room. Continue on. Riley is not here. He did call. He's had some state mandated training for his emergency services folks. So he had his report. I'm sure if there's any questions, you can contact him or myself and we'll get you the answers. Next up, probation, Mr. Tyrone Thomas.
Hello, everyone. Not much in my report. Just one thing that kind of came up today is, we've had in our give cases, and so we're probably at 10 give cases. I think we have maybe one or two more coming, I believe, which is, it's a lot for an officer. And, I know everyone's strapped and understaffed, but just having to handle that overload case and not having that other officer, I had reassigned those cases to my part-time give officer, and now we're looking that we're gonna have to pull those back and do some other things. So we're really trying to balance some things out, but we'll do the best that we can, but I at least want to put it out there. Other than that,
We have a couple of resolutions. We'll handle them right now. JP3, authorizing the chairperson of the legislature to execute an agreement between Cayuga County Probation Department and Supercom for electronic home monitoring services.
So this is just moving, we were working through RMS and they were charging us $9 a day for electronic home monitoring service. When we looked around, we found that we could get this done at $3 and
50 cents, I think.
Yeah,
What it says.
something like that, way cheaper than paying $9 a day. We tried to get RMS to get down, but the best they could do was $7. So this is just saving us some.
Okay, I need a motion for JP3.
Move it.
Need a second?
Second.
I got a second. Any discussion on JP3? Thank you for doing your diligence and chopping around. All in favor?
No, I got a
Nope.
question.
Okay, go ahead, sir.
Tyrone, is there a limit to how many they can operate for us at a single time or what?
Like, so right now, like with the current company that we have, they come down, they hook everybody up. And so they just bring them as needed. This company will give us 30 to put on the shelf and they'll only charge us if we use them.
Thank you.
Outstanding.
Do you have staff that does the monitoring?
Yeah, so
So it's internal to your department?
right. So right now it's my give officer monitors. Most of the people on GPS are give, unless there's like a specific sex offender or something that we put on. Other than that, he would monitor most of them. But if it was somebody else's case, they would monitor it.
So you hurt your foot when you're breaking the contract with the other company? Or?
Yeah.
Yeah. Are the gift cases in any way different than a regular probation case?
Just because it just requires more because we have to supervise them at the greatest risk. So
Oh, so it's higher level of supervision
Right.
if it's coded GRIV?
yeah, or strive when we get cases up and running. So basically it's a contact
Mhm.
once a week and they have to do a home visit at least one a month and plus the GPS monitoring.
Mhm.
And then I think there's like 12 collateral contacts.
I just didn't know the significance of what is required by.
Yeah, it's a lot more.
Okay, I think I have a motion and a second, correct, Fred?
Yes.
All right, all in favor?
Aye.
Any opposed? Carried. JP4, authorizing to fill one probation officer title in Cayuga County Probation Department.
Move it.
I have a motion. I need a second.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Carried. Anybody have anything else for Mr. Thomas? Oh, go ahead, sir. Oh, yeah, I don't have that. It's not in. Is it? It's on the back part?
No.
Nope. Okay. This would be, does it have it doesn't even have a number here, so.
Yeah, I sent it into the resolutions and the contracts, I think.
Fred dropped the ball. No, I'm kidding.
I did.
No, I'm kidding.
I'll read it really quick here. It's authorizing the chairperson of the legislature to execute a contract amendment between the Cayuga County Probation Department and Catalyst.
Yep.
Court and land records for no cost access to the system. Basically, they go through and list all the stuff, but it's no cost to the county, correct? Is it a match, 100%?
No, it's just, they're just giving it to us.
Oh,
Because when we originally got Caseload Explorer, like this was gonna be an additional cost, and probably, I wanna say it's like $700 a month, like a month to access C Analytics. And so I think in 2017, just opted not to have that option. So OPCA did something with Catalyst and got them to give it to us for free. And so there's been this big push to get it. And so we were like one of probably like 4 counties that haven't done it yet. just because when they did the upgrades, they just did them. But since we're hosting our own caseload explorer as opposed to them hosting it, we have to get some permissions from like IT and so forth to do any upgrades. So this would, it allows us to find some other avenues with helping us find different things that are happening with our cases, along with giving us ability to run some reports that we need to run, but haven't really had that access. So every time that we need this specific information, we'd have to go through every individual case and kind of go through this. This will kind of run and do it all by itself.
I'll move it.
I have a motion. I'll need a second.
Second.
I have a second. Fred, just a quick question. This does not have a number, so temporarily or for this meeting, can I refer to it as you can refer to it as 6010, yes. Thanks very much, sir.
And I'm just being a stickler on this because it requires an amendment in a contract, so it's safer to go through.
That's fine. That we'll handle that as it comes.
Yes.
For Ways and Means.
It'll be all set for Ways and Means.
Thank you very much. So I have a motion and a second. Anybody have any discussion on JP 10? Hearing none, all in favor? Aye. Opposed? Carried. Anybody have anything for Mr. Thomas? Thank you. Everyone appreciate it. Eel?
You feel better?
Thank you.
Don't get caught speeding.
It's a pain in the
The
sweat.
sheriff is available.
Don't get what?
Next up, we have the sheriff.
Good afternoon. I don't have anything to add to my report, but I did bring some information relative to our navigation division that I was going to go over if I could.
Thank you.
Thank you. I had a discussion with Legislator Daly, Personnel Committee meeting about our navigation division. Some questions popped up and I hope I could talk a little bit about tonight, today.
Absolutely. So, I guess, do you want to give us a brief or do you want us to just rattle questions off you or what?
So this graph depicts what's been budgeted since each year since 2015 for our navigation division. That would be for part-time police officers and part-time navigation assistants to be assigned to that detail through the summer. The top line is what was budgeted each year. The part-time salary line below it is the amount of funding that we actually utilized each year. You can see that since 2016, that tapered off. That's due primarily to the fact that we haven't been able to hire part-time police officers and part-time navigation assistants. We just haven't had very few people apply for those positions. What we've done over the course of those years is filled in some gaps with overtime funding with our road patrol division. So we've had to put road patrol people out on the boats when we don't have part-time people available when we're covering those details out on the water. I don't have the figures for how much overtime was utilized each year since 2016 from the road patrol division, but I can tell you in 2025, last year, we used about $30,000 in overtime to cover the road patrol deputies that were out on the water when we couldn't get part-time staff. So there were some questions that came up about trying to make sure that we're accounting for that or showing that in the budget in such a way that it's very clear what we're spending on our navigation patrols, and we can certainly do that differently moving forward. But I did bring this primarily, I wanted to discuss this because I am bringing a resolution forward next month to fill our part-time seasonal positions or try to do that again with trying to increase the salaries for those two positions so we can try to attract some people because it's certainly much more cost effective if we can do that with part-time people versus paying overtime to our road patrol folks on the water. We do get reimbursed from the state. We get 50% reimbursement for those salaries for the time out on the water, but they don't reimburse for the full overtime hour. So it would just be a straight time hour for a deputy. So it's obviously much more expensive to have our people out there, earning overtime at a patrol salary than having part-time people doing the work. So I just wanted to bring that forward to kind of show you the progression, what's happened. We did spend Even with the overtime, we spent less this year than we did in 2016. But, you know, there certainly is an issue because we can't hire those part-time staff. So we're trying to address that.
And there's two categories of staff, Sheriff. One is the guy that sits on the boat and the other, the one that has the ability to,
There's a navigation assistant
okay,
who's there basically to assist with the duties on the boat. And then
Yep.
there's a part-time, would be basically a part-time deputy position or police position. So at least one person at all times on the boat has law enforcement authority.
okay.
Sometimes we have two, sometimes we have one, depending on what we have available for.
And there's a
personnel.
difference in rates because of that. Yep.
And just to be clear, the reason that we have to have a law enforcement officer on the boat is because a peace officer like myself cannot arrest or write a citation. So you have to have a law enforcement individual on the boat to handle those issues if they should have to come up. So that's why we're required to have that.
And that might be harder to recruit than the assistant. I mean, we talked a little bit about the assistant and maybe looking at people who apply to be lifeguards or Diane was going to help.
It will continue to be challenging to hire a part-time police officer. One of the
Yes.
challenges is that back in the day, our boats used to be out all through the week and the weekend. Now we primarily just put them out on Fridays, Saturdays, and Sundays when there's a lot of traffic out there. It's hard to find people that want to spend each, Friday, Saturday, or Sunday in the week, on the weekends in the summer, working part-time when they're working full-time somewhere else, or that's one of the challenges. So I'm not really sure what the answer is, but it used to be quite easy to fill those positions, but it just, really since 2019, 2020, it's been very challenging to find part-time police officers that are willing to do this. We had one last year that did it, and it's been very difficult to find them.
I still wish I could submit my resume, but it doesn't happen.
So we can account differently we could certainly show the overtime. My goal would be to fill all of those slots with part-timers and not have to use any road patrol overtime, but we have to put those boats out there at certain times, and we don't have any choice but to put deputies out there when we do it. We had one drowning last year that we assisted with on Cayuga Lake. We have had years where we've had multiple drownings. The overtime really racks up when those things happen. But just the weekend day patrols that, that certainly can get expensive when we're utilizing overtime. So we try to limit the amount we put the boats out. We're not putting them out there Monday through Thursday anymore unless there's if there's fireworks or there's some type of specific event or something that we need to put them out for, we will, but we don't generally do that through the summer.
Go ahead.
So something like a significant, like a drowning happens during the week, then you would take someone off road patrol and they would take the boat to that location?
It would be, somebody would come in on overtime and work that detail. We have had a few incidents. If you remember, it was a pretty nasty crash down near the Aurora area. Two boats collided. Some of our members actually, I think one left the patrol car and actually jumped on a boat to go deal with that. So, we're not heavy on the road where we can just lose people on the road. But if there's an emergency and the boat's not on the water, then a number of our people are trained and can jump out of the car and jump in a boat and go get out there. But that's not ideal either because it leaves us short on the road when that happens.
Anybody else have any questions or concerns with navigational? Sheriff, we do have multiple resolutions for the evening. Get right into them. JP 5, authorizing the chair of the Cayuga County Legislature and the Cayuga County Sheriff to sign an amended contract with the Weedsport Central School District, providing full-time special patrol officer employed by the Sheriff's Office to the Weedsport Central School District to provide school resource officer services. I'll need a motion for JP 5. Second?
Go.
I got it. Any discussion on JP 5? Just to be sure that, I assume that's the same as Moravia, the school district.
They do, and they do have the additional fee in there for the administrative fee. This basically just cleans up how the budgeting was worded in the contract so that they can budget a little bit more accurately to what they're actually spending, but it has no financial or fiscal impact on the county.
All in favor, JP five?
Aye.
Any opposed? Hearing none, carried. JP six, authorizing chairman of the Cayuga County legislator and the sheriff of Cayuga County to enter into a memorandum of understanding to allow New York State Department of Corrections and Community Services, better known as DOCS, to access 3 law enforcement channels with the Cayuga County PD 911 network. Need a motion?
Move it.
Need a second? I'll second it. Any discussion on JP six? Hearing none, all in favor?
Aye.
Any opposed? Carried. JP seven, authorization to extend the agreement with LexINexus for the electronic law library services at the Cayuga County Jail. Need a motion?
What?
Second. Any discussion on JP seven? Hearing none, all in favor?
Aye.
Aye. Any opposed? APA, authorizing the sheriff to fill 1 vacant detective position in Cayuga County Sheriff's Office and any backfill. I'll need a motion. Second,
Second.
any discussion on JP eight? Hearing or seeing none, all in favor? Any opposed? Carried. Moving right along, authorizing the chair of the Cayuga County Legislature and the Cayuga County Sheriff to enter into a contract with Lexipol to provide law enforcement personnel web-based training services via their Police One and Corrections One portals. The motion for JP nine. Second? Second, any discussion on JP nine? Hearing none, all in favor? Aye. Any opposed? Carried. Anybody have anything for the sheriff or any sheriff, you have anything more you'd like to pass?
I don't have anything else. Thank you.
Have a good night.
Thank you.
Next up is stop DWI. Deb Dennis, please.
Hello. I don't have any resolutions this month, but I will have one coming up next month, and that will be for the night out at the Doubledays game that has been scheduled for Friday evening this time, not a Sunday, so it's gonna be Friday evening, July 17th. I will give you updates as that gets closer, but that resolution will be here next month for that. I just want to give you some numbers. I think I mentioned last time that I was working on an annual report that I have to do for the state that's due in May, so I just keep an eye on this, kind of this ticket management and research database that I get the information from. So right now, preliminary for 2025, there were 189 drivers ticketed for impairments. To compare that to 2024, there was 164. The kind of it seems for both male and female, the general age where the majority of these tickets are happening are between male and female, between 30 and 49 years old. So just wanted to pass that along. I can give you the report when that's due with a lot more of the statistics that I'm required to keep up with. As of now, I have 3 school districts who have requested after prom funding. That's Weedsport, Union Springs, and Southern Cayuga. 2 of those checks have already gone out, and I've sent a reminder to the other schools, and I'll keep you informed of any other dates upcoming. If there's any tabling events or any special events with DWI presence, I will keep you updated of those dates as well. And then my next meeting for the Stop DWI committee meeting, that's going to be on March 3rd. We meet as a committee in the county right after the traffic and safety committee meeting. So that's what I have going on right now related to Stop DWI. Do you have any questions?
Anybody have anything? I do have one comment, Deb. The Stop DWI program for the schools, I have attended several events through the years in multiple school districts. It is a wonderful program. Believe it or not, the kids do actually get something out of this. One of the major things down in this, in Moravia is they go through a DWI event as it would, just like it would happen. It'd be some sort of an auto accident.
Mhm.
They, they have the fire people come in, they fly in a helicopter. They, find, usually a deceased individual. Then the sheriff's department comes in, they, go through the arrest, whole procedure, they get to see it actual. They have a mock court They bring in a judge, they actually, explain what the charges are, what they're charged with. They go through the whole process. And it's an eye opener and an awakening for some of the kids, not all, but some. And I think it's a great program. I'm glad to see that there's folks taking part in it, and I hope it continues. Thank you.
Yeah, I was at the one in Moravia last year. It was the first one I had witnessed, and it was very eye-opening. And I think tentatively there was some interest in perhaps Southern Cayuga participating in something similar to that in 2026, but I don't know any details on that yet.
Really sure.
Weedsport has done one in the past, yep. And this year they actually received a grant for an Arrive Alive tour, which hasn't been scheduled yet, the date, but there'll actually be somebody from the state coming in and setting up demonstrations and driving VR type things with information available that day at the school for like a 5-hour time frame. So I'll let you know when that date is.
Very good program. I'm very happy to see it here. Thank you. Anybody have anything? Ms. Dennis? Thank you very much.
Thank you.
I believe that's the end of the schedule for tonight, so I'll entertain. Motion in a second.
Second.
All in favor?
Aye.
Next up.
All right, well, we're all in place, so. Get started then with Health and Human Services. I'll call to order. I didn't see, is Aileen not here?
She's been excused tonight.
So I'll just go through roll call. Elaine Daly. Here. Aileen was excused. Ben Vitale. Tom Winslow. Can I have a motion to approve our January minutes?
I'll make that.
I'll second.
In favor?
Aye.
Then we'll go into department updates and resolutions. Kathleen Cuddy from the Health Department first.
Good afternoon. Whatever, right?
It's all together.
We're still here. Would you like me to do the report or do you want the
Yes.
resolutions?
Yeah, if you want to start with your updates that you gave us real quick.
Great, thanks. So some good updates to give. Our state aid application for 2026, the fiscal side has been submitted. Our narrative programmatic side should be in another week. So that's good. Then we'll start working on some statistical reports to share with you data from 2025 regarding programs. We're continuing to work on filling vacancies. Right now, we have a number of vacancies. Our Director of Environmental Health. You'll see tonight, we're going to request a part-time public health engineer, sanitarian position, an environmental health technician position, the lead rental registry manager, the outreach coordinator for lead rental registry, and a nutritionist for WIC. So if you know any people who have interest or eligible for that, we welcome them applying. And we certainly can talk with them more about what the job entails. We have a septic system inspector class that's starting the end of March. So sign up will be going out soon for that. People can call the health department office for more information about that. There are some qualifiers as far as background and knowledge for that. Rosalind Fagan is our fiscal manager. And just this week, she completed a local share report for 2025, where I think it's good information to share with you. And our 4010 account, which is our public health account, which is communicable disease and environmental health. We were over $64,000 less in our year-to-date actual local share cost than in our budgeted cost. That is due to vacancies. So that's not a good thing, but that's the actual cost. Now, of course, we have to keep in mind that some of our costs are supplemented with grants and our performance incentive money, which is optional funding that we work toward attaining each year. Nonetheless, for our 4012 account, which is our certified home health agency, which we no longer house, there is a retirement cost of $186,000. That had no change. That was as budgeted.
Those are the health insurance costs of the staff that retired from the home care agency.
Yes, yep. Account 4044, which is our early intervention account. We had a local share savings from what was budgeted of $34,000. Now I'm rounding the numbers, of course. We believe one of the big reasons for that is the EI hub is now functioning better, and we're seeing a more quick reimbursement rate, turnaround time because of this automation, particularly for the work that our early intervention service coordinators do. With our early intervention service coordinators, we get 100% back on Medicaid, children who are Medicaid eligible and have Medicaid, which is about half of our census. We get 49% back for our non-Medicaid children participating. That comes from the state. It's a much slower reimbursement though. So we believe it's because of our Medicaid children reimbursement. On our 4045, which is the preschool special education, from what was budgeted to what the actual local share cost was, it was an improvement, was a $630,000 savings, which is certainly significant. Our tuition was under budget. We believe that's because the local preschool special education school had opened up a third classroom this past year. So more children were served locally, which thereby also decreased our transportation costs, which is a good thing. We did see an increase in related services, which is the therapists who are going out into people's homes or their daycare. But additionally, our utilization of the McGinnis software, we're now in the second year of our partners using the McGinnis software. We've been using it for a few years, and that has definitely improved paperwork turnaround time, so we can claim that much sooner as well. So that's a really good thing. With our WIC accounts, 4082, we were $22,000 less than what was budgeted for the local share, which is money we put toward retiree costs there. So similar to the CHA, the home care agency, WIC also has retirees, and we were able to use unallocated funds and some unspent funds from our WIC grant to offset the county costs for retirements there. So in total, it was over $754,000. I'm really, a lot of credit to our staff and finance staff for that.
Yes, they do an excellent job trying to make sure you're maximizing everything you can maximize.
They really do.
Grants and
They really do. That was good news, right? It's good news to be able to share.
I'm sorry, where did the classroom open? Where did the capacity increase?
The Gabra Center
They did?
had
Okay.
2 classrooms for the past many years. This past school year, they have 3 classrooms.
Okay, so that's another local option that,
And the transportation was saved. There was yet another school that opened in Camillus that serves children also. So not as many needed to go to Cortland or into Syracuse or elsewhere.
because that's a huge cost to transportation, right?
It's a huge cost. Yes. That actually we're having further conversation with Amanda Grady to talk about potentially going out RFP again for transportation, because we are eligible to do so. If we choose, we can carry it over another year if we need to. And I thought I'd just give you a few updates. Our state association put together some summaries based on the proposed budget from the governor. As you all know, there's a lot of, activity at the state level in Albany right now for people looking to make changes or not. But we've got some good news there at the moment. There are no proposed changes to the Article 6 state aid funding formula. So we can feel good that we should continue on with the same grant reimbursement. I say it was state aid grant reimbursement, which is $750,000 base grant, and then 36% to the dollar for expenses spent in state aid, which are the majority of our health department programs. There's some increase to the preschool funding, but that's really going to offset some state shares, not the local shares. Dual settlement funds appear to be reappropriated, but maybe a reduced amount. We have not started utilizing the dual funds that we've received yet. We've got some thoughts on how they may be utilized, but there's no personnel tied to those at this point in time. A lot of activity talking around adding staff to support crackdowns on illegal vape products, and there's a lot of regulation spoken about there. Capital project wise, there's $20 million appropriated to the lead abatement line for the Leading in Lead program under the Division of Housing and Community Renewal, which are grants for landlords in designated communities of concern who need to comply with the lead rental registry. That is a grant that we receive. It is for the city of Auburn as the community of concern. So we're pleased to see that may continue onward because it is an opportunity to go to the source of what much of our lead poisoning is caused by, which is lead paint. And then there's also a budget adds 5 years, $3.75 billion commitment to support clean water infrastructure, which, as we know, is only a good thing, aging infrastructure of our communities and all over the state. There's a few other things in here, but those are kind of I think, the points of interest for most of you at this point. And as things change, right, we know right now that this is just the proposed work. So who knows what may change down the line. And that's all I have.
Thank you. Thanks for the breakdown of the financial part too. That's very helpful. And I want to say thank you to you and your team for letting me see the building. I definitely have a new appreciation for how many different things the health department does, and how happy they were to do it. Your team, you have a really great group of people.
Well, I agree. And thank you for coming. People really appreciate getting to meet their legislators in person and having people, the legislators know where they are. And I know that all of you have, seen the health department over the years, and it does not go unnoticed. It's appreciated.
Great, thank you. You want to get into your resolutions?
Yes.
Okay, so HH1, authorizing the chair of the legislature and the public health director to enter into contracts with professional engineers for assistance with septic system and public water approvals. So, and in the resolution, it says you have multiple contracts so that you can get whoever's quickest. Is that how that works?
Correct. This is something that we initiated last year. We'd like to continue with these contractors and others who may have interest. So if there's contract engineers out there interested in contracting with us. And they really helped us during the absence of our director of environmental health, who was an engineer.
I'll move it for discussion.
Second.
Didn't we fight about a rate last time?
It was an RFP.
Oh, so
no, yes, we did. And then they had to submit what they would work at for the rate.
but it's not in the resolution, remember? There's no rate.
Because some of them were this rate and others of them bid this rate. Most of them are $150 an hour.
Yeah, remember we had a big discussion about, would it say?
Then we ended up going to a not to exceed.
Yes.
Right. And so it's $150 an hour. That's all we're paying. Yeah.
So should it be in there?
It could be if you want it there for posterity purposes, but I think depending on the number of contracts, you may have a variety of rates.
You might get someone for $125.
No, but yeah, the not to exceed is.
Well,
But the-
right.
The contractors' rates are in there.
They're in
You know,
contracts.
Different contractors and different rates. That's listed in there, but
The rates are in the contract.
There's nothing in the resolution.
I don't believe they're going to be in the resolution because they may vary. And this allows some flexibility if there's nobody.
Okay, I just remember last time it came up, you were interested in having some kind of reference to the payment, that's all.
If there's a new contractor who does this specialized service and it's $175 an hour, we're still going to want to contract with them. If their expertise is public water and municipalities.
So if we tied our hands under a rate, we might be in a position where we can't use anybody.
Or we won't have anybody in a timely manner,
Yeah.
I guess would be more the issue. Like I can come back here, that's not the issue.
because even though it's not in a resolution, it's somewhere that states how much contractor's rate is.
Yes, it's in what they bid, what they gave to us.
So it's not just an open-ended.
Correct.
But if you looked at all the people who RFP'd, there would be the highest rate and the lowest rate. There would be 125 to 175 or something. I'm just saying, usually you have a rate.
It'll also depend on what they specialize in too.
Yep.
there's a big difference between doing a septic system and doing a public water system. That's,
I mean, if everyone's comfortable passing a resolution that has no reference to what they, I don't, fine by me.
contract, it's.
It's in the contract. Yeah, but whatever you guys decide.
I think if it's in the contract, I think we're covered.
Okay.
All in favor?
Disagree, I guess.
Aye.
So when the auditor looks, she'll look at the resolution and then she'll pull the contract to see about,
For that person. So
Yeah.
Elaine Daly, you're 125. Tom Winslow, you're 150.
and that's how
Giving
it,
you more of the work if you're turning it around in a timely manner because you're cheaper than you, who maybe has more people and you have your junior person approve it and then you have to
so the
double.
RFP was based on what was submitted and that's your pool to deal
Yes.
with. Okay.
Sorry, I jumped the gun. All in favor?
I,
Any opposed? Carried. HH2,
just one more question. Are you worried that you'll have enough money to do this? Or no, you have a pretty decent
Not in
amount,
February, I'm not worried, but by August I will be. Yeah,
yes.
yeah.
I mean, this was an estimate, right?
Yep, and in our professional services line, it's as
Building a house. in
everybody's
December.
dealing with, we're
Yeah.
contracting out in a lot of things and
Wait till.
it costs us.
Yep, totally. And you'll be transparent with that, I'm sure.
Yes.
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 HH2 is pulled. We're gonna assess what you're looking for and then bring that back at a later time. HH3 is, you mentioned in your report, but authorizing the legislature to create the public health director to fill the director of environmental health position. Can I get a motion for discussion?
I'll move it.
Second?
Second.
We updated the job description for the Director of Environmental Health to contain the same qualifications as we had had in the past, which was a professional engineer. But also, because it will be challenging to find a professional engineer, incorporate what a background would be for someone who could be a director, not engineer. And it's incorporated in the one job description.
When Kathleen came to the personnel committee, the conversation was like, I would love to hire a director of environmental health that has an engineering degree. I'm realistic that I may not be able to do that. So if I'm not able to hire an environmental director that has an engineering degree, then I'm going to hire to oversee the environmental health programs, but I'm going to see if we can recruit and advertise anticipated a part-time engineer to supplement the work. That's kind of what, and that's really what Diane is working. You'll know when you try to fill this, what you may or may not get. And if you don't get someone with an engineering degree, you'll likely come back after you have seen interest if a part-time engineer would come on. Otherwise, you're stuck with this contractual arrangement.
Yeah, and Amy and I had some discussion when she came by. We're going to have to try to look to expand our contracts if we don't have this
Yep.
because the state is helping us in a pinch right now
Yep.
for certain things, but they are challenged by having enough engineers on staff as well. And they have someone in anticipated leave during peak season. So it's concerning. And as I mentioned, public water is my biggest concern.
I'm going to guess the pay rate is the reason why we don't have a professional engineer now.
That would be correct.
You mean
Yeah,
as the environmental health director? Yes, I mean, not every bit of work is engineering work for that position, so.
No, but a few months ago, I mentioned that we really lack in that area, not only just in health department, but also in the
Yep,
planning department also. And
yep, and
important issue in our area. We got a lot of water.
I looked up, I did a little bit of market research too, and it seems like the rural communities like ours pay less, so you're probably competing with $200,000 jobs in bigger areas, right? So getting someone who's highly competent that does both is going to be a little tricky.
And that's why you didn't want to tie yourself to the pulled resolution because it looked like it was going to be 40 some dollars an hour. And realistically, you're not going to get someone part-time at an hourly rate like that. So go out and try to recruit and then come back in and see.
Is there a certain time frame if you don't recruit by that we need to go back? Because it's costing money having it vacant, right? Like, is there?
Sure. So that, I think that's something we'll look to see what we're spending on our contracts.
Yeah.
What the state's doing for us. And we'll have to try and monitor that as well as we can. Now, we don't get a sense of what a translated cost for what the state's doing for us. At this point in time, I'm asking the state to cover our municipal water system work because it's so very technical. Part of what was shared with me when I spoke with the regional office, the engineer there, not only about the challenges, but my concerns. And he gave an example. He goes, well, I'm asking the state to come and have an orientation. I want to set that up with our contracted engineers so that we can have some confidence that the engineers are all using the correct technical manuals. Oneida County had an issue where they contracted to an engineer who built a swimming pool that might have met some engineering specs, but did not meet the state technical. And it was a huge cost and lawsuits.
Oh, yeah, we don't want that.
So we have no way, like I can't look at what our contractor sent in and said, oh, yep, they did that. Nope. So we're going to do what we can to put that safety under there and write it in the contract that says, make sure you're using these most current technical manuals. But I forget who said it, we'll have to look at what we're spending. My opinion, people know already, should be a better rate.
Well, this resolution at least gets the ball rolling, you can see, and then as we meet, we'll have to just keep seeing if you're getting anything or not.
Great.
All in favor, creating the.
Aye.
Any opposed? HH4 is authorizing the public health director to carry out a budget modification in the WIC program budget, so
Move it.
that's not my specialty, but I did add those up in the resolution and confirm that they match. So you're taking out the 22,462 in those listed costs and then increasing in another area for the same amount, right?
Correct.
I'll move HH4.
Second.
Second. Any discussion? It's pretty straightforward. All in favor? Last one for the health department is authorizing the public health director to accept $23,084 from New York State for participation in Article 6 State Aid Year 13 performance incentive program activities completed by the health department.
Move it.
Second.
Tim? All in favor?
Aye.
You have flexibility on how you spend that too, right?
We do. So I want to give a lot of credit to Megan McCall, our senior health educator who completed this. This is optional and there are some counties that don't take part, but the topic area was regarding climate change. We had to do some website and education around weather issues and access to information. And Megan gave me a great synopsis, which I have on my computer and not in front of me. But because she did that, we're able to get this state aid funding. We have flexibility. It will probably be used for professional services. But we're glad to have it. It gives us a little bit of something to flex with.
Great. Thank you.
Great, thanks.
Lauren Walsh. Do you have any updates? You want to dive into
My resolutions are sort of
the updates? Okay,
if you want to do those, that's.
sure. So you have 7 resolutions.
Yes.
I was going to bundle HH 9, 12, and 13 because they're all filling positions that were budgeted for. 9 is or to fill one full-time coordinator with the substance use initiatives. 12 is filling a staff social worker, and 13 is filling another social worker position.
I'll move those for discussion.
A second.
And just,
The only reason why it says create is because they're help.
yes, right. The coordinator of substance use is a grant funded position that oversees the collective work you do around substance use disorder.
Correct. And oversees the grants that we have currently. And that's funded through the grants and also opioid settlement funds. So if there's no grant funding, then that position goes away, just like it says in the resolution.
Question. Any of these positions currently filled?
Yes. The social work positions are, one person's retiring and one person put a resignation in. And so when they're out of those positions, I mean, we'd be filling.
That's the reason for the vacancy.
Yes.
Thank you.
Yep.
Okay, any other discussion? All in favor?
All right.
Bundle, thank you. HH10 is accepting New York State Office of Mental Health funding for AOT program.
Move it.
Any second? Any discussion or questions about that? Lauren?
So this is the amount that we'll receive for this year. It's sort of for this year and last year. We have a certain amount of time to spend that funding. And then moving forward, it will be about just under $220,000 each year for state aid funding we'll receive for. It's really meant to enhance the AOT program, not necessarily to have more AOTs, but just to be able to educate the community and do more community outreach and education around it, as well as a step below an AOT would be an enhanced voluntary agreement, which there's a push for kind of educating the community around that as well, and agencies.
Does that require a court order too? Enhanced
It
voluntary?
does not.
But the AOT order does. So people could agree to be supported.
Yeah, so sometimes those are used as like a step down from an AOT, like if somebody's done well, but they still need some monitoring, we'll do an agreement that way. But part of this is also to develop some pretty detailed policy and procedures around AOT in individual counties and how it kind of flows. So that's a big project for the AOT coordinator to also do as part of this.
Was this funding already in your budget? That's why.
No, this is the acceptance of the fund. So we really haven't figured out our plan for using the fund. This is more just, this resolution just is accepting those funds.
Just gonna go in a revenue account and then you're gonna offset your current work with it?
Yeah. Until we kind of internally figure out a plan, because it's a lot of money. We want to make sure that we use it.
Can you use it for staffing and stuff, or it's
You can use
just?
it for staffing. You can use it for, there's a lot of things in there that are unclear. It's new money, it's new state aid, so a lot of counties really aren't 100% sure what their plan is going to be and how it's going to be used. So this is more or less just accepting those funds until we, can develop another plan.
Does the state base the allocation on how many you have?
No.
Like, how do they decide how much money to give?
I think it depends on the size of your county,
Oh.
really, is because, you could have a large county with a large city, but not have as many AOTs as other counties do. It's very much how each county kind of functions, how many AOTs they have, and obviously how many people meet that criteria and could benefit.
All in favor?
Aye.
Then 11 is authorizing the county of Cayuga and to enter a contract with Cayuga Counseling Services for the reimbursement of costs associated with the screening for eligible patients in Cayuga County using flip funding. I know, if we can move to discussion, you have something to share.
I'll move it for discussion.
I'll second for discussion.
Yeah, so you're a trailblazer in the finding?
Oh, yes.
Share.
So you may remember me talking about this and how we weren't eligible as a government agency to receive any funding to provide screening This is a Medicaid waiver, so anybody who is on Medicaid managed care is eligible for additional services, including housing, transportation, food. So Cayuga Counseling is able to actually be set up to get reimbursed for those. So we're gonna enter in a contract and be underneath Cayuga Counseling as users in the platform that you have to submit. It's the first county clinic or DCS it's figured this out in the entire state. So I also know that the state is asking to come talk to both me and Sarah Van Doren, the executive director of Cayuga Counseling. And potentially this could open up the gates for maybe other county clinics to do the same. We already screen for social determinants of health in our intake form. So this would be our intake workers. We're really trying to figure out the workflow, but it shouldn't be a heavy lift to just enter those screenings into the platform in order for them to reimburse us for each screening. It is $17.50 per 15 minutes that you spend with a client.
And based on the questions, you're supposed to link them to care that they need? I mean, is that?
So once the screening is done, there are agencies that are providing some of those services within our county, Cayuga Counseling being one of them. So if someone qualifies for food assistance, and again, this is not a duplication for any DSS services that somebody receives. They can get groceries ordered to their house. They can get their rent paid or back rent paid based on their eligibility.
And there's no additional cost to do it. You're just going to be able to recoup.
We're gonna absorb it.
Yep. The only other way they would have to come to your mental health clinic and screen your patients, which doesn't seem very efficient.
And then they would get reimbursed.
Right.
Yeah, it just gets.
Just more people get screened for these possible
I'm sure the
supports.
patients don't love that because there's more people involved. Right?
Yeah, and I mean, we have at any given time, right, like probably 2,100 clients or more. So a large percentage of those are Medicaid managed care patients. I think there was some, I think we have over 17,000 people on Medicaid in Cayuga County. And the thought, I don't know, their analysis was over 15,000 people should be eligible for these services. And there, as of a few weeks ago, there was about 500 screenings done. So we're not even touching the amount of people that could benefit from these services. And we just want to do our part.
These are managed care patients, not straight Medicaid patients. Yep.
Yeah.
Okay. Great, good. I know you pulled it and then you had it.
Yep, and here it is. It's back. Yep.
Warren, that 17,000, is that high, low for
So it-
our size?
I'm not sure, to be honest with you. I don't know.
Didn't somebody, Kathleen, didn't you do statistics about poverty or where did we hear this? At Board of Health?
In our community health assessment, I think Lauren was probably only just, I don't even know if I sent it to you yet.
But I mean, we do have,
Sorry about that.
we have more poverty. I mean, there are some findings. Maybe you could go over that. That was pretty interesting next.
We would love to have Megan McCall come,
Mhm.
maybe at the March meeting, if you're okay with that.
Yeah, because no, it was interesting about the number.
You know, a report, I mean, we
Do you
don't
want
need
it at the
to.
last meeting? So that everybody hears it?
I think we've got presentations planned. Let's do it at
Well, you tell me.
HHS next
Okay.
month.
And we'll see.
HHS next month would be fine. Just a report. It doesn't have to be.
Because it sort of speaks to
Long way.
the poverty levels in the county and
Just
some.
a curiosity, I mean, 17,000, are we high or low? Just, you know.
Same thing you're looking for, what she did at Board of Health, just so I.
Yeah.
Okay, perfect, yeah.
Yeah, and I think my point is, we're not even hitting
Yeah.
close to, we're not even hitting most people that could benefit from the services. So
Mm.
we just
There's a lot
do
of-
our part. And obviously it's nice that we can get reimbursed for it as well. We were gonna do it anyways, because it's the right thing to do, but it is nice that we're gonna be able to, we figured it out to be able to get paid for it as well.
Yeah, that's great.
Yeah.
All in favor?
I,
Okay, so 12 and 13 were part of the bundle. HH 14, authorizing the Director of Community Services and the Chair to continue contracting with various agencies for substance use and mental health services funded by the opioid settlement funds.
move it.
Second.
Any discussion? This is,
So these are already existing contracts that we have with both Chad and Nick's Ride for Friends. Chad is for prevention services. They are in majority of the school districts doing prevention work around substance use. So that is continuing that contract for one more year. They believe that that will buy them time to be able to sustain that work. It's definitely more than they expected. It's grown a lot quicker than they thought. They're in a lot more schools than they had originally planned. So we want to support that prevention work. And then Nick's Ride, they actually have a pier in the hospital. And so they want to be able to continue that program for another year. They do feel like that will give them time to be able to again, sustain that work by also maybe having some conversations with the hospital, but also their billing that they're able to do for the pier work that they're now actually able to bill Medicaid for. Also with Nick's Ride, there is a small, it's called a Breaking Barriers contract that we have, and that was existing through the Healings Community Study a few years ago, and that's really for any reason, small reason why somebody can't, they need something in order to make it to treatment, whether that's a phone card, so they have a phone to be able to make appointments, or, it's just little needs that somebody has that we're able to kind of use that fund to provide to the person for
You're
that.
accepting the funds and passing it on for what it's intended.
We've already accepted the
So,
funds,
yeah.
so this is just continuing two existing contracts that the Community Services Board had voted to fund initially when we did the RFP.
All in favor?
Aye.
And HH 15 is authorizing the Director of Community Services to accept regional OMH state aid and to enter into various regional OMH state aid funded contracts on behalf of New York Directors Plan.
I'll move that.
Second.
Now, that was a leftover from Ray, who made you guys the kind of hub for this.
Yeah, so our regional DCS group is the CNY DPG, as well as the Director of Hutchings is a part of that as well. So that is a group of DCSs. We meet, twice a month. We do a lot of planning together. This is state aid funding that comes from OMH to be able to, for us as a group to determine, is there regional needs that we use the same. This pays for our Liberty Resources crisis after hours that we do from the nighttime hours and on weekends. So this is existent in majority of those counties, and we use that funding. That's the biggest thing that we do with the funding. But yes, Carol is the accountant for the state aid funding, so we accept it here even though it's used regionally.
Pass it out.
And we do the contracts as well because we receive the money.
Great. All in favor?
Aye.
Great, thank you. Lauren, just because we talked about it last time, and I don't think we just looped back an email, but the funding that was taken away was given back. So that's no longer an issue.
No longer an issue now.
Sam's grant.
Yep, so everything we're able to access all of our funding, we're able to continue to plan. We've been told that things are good to go for now, but I think, like I said before, we're gonna just start sustainability planning earlier than we would have, just for the anticipation. We don't know what
that could happen.
So we, again, like I said, we're starting, everything submitted for the satellite office for Moravia School District. And then we have some conversations happening with Cato to get that ball rolling if they're interested. So
Good.
we're getting those things in place just in case.
Yeah, that's a relief though.
Yep. As of now, we're good to go. Yes, we were so glad to see that. So thank you.
Thank you. Christine.
Yep.
Thank you. Do you, I was gonna ask you a report, clearly you have there's a lot of information here. Do you want to summarize for us what we're looking at? Thank you.
So there's a lot of information on here, but I'll run through some of it. Try to be brief, and then if you have other questions as you look it over.
Perfect.
We can talk about it whenever you like. So the first page is a summary of 2 years worth of data that comes out of HMIS where clients report their zip code of last permanent address. The last time I was talked about this here, it was a 4-year time period of 2020 through 2023, I believe. And I think it was in the fall, I was asked to put together this when I had some time to capture what things were looking like. So I took the last 2 years that we hadn't captured before and got the data out of HMIS, asked for it, and this is a summary. So what it really breaks down is how many individuals were homeless. And during that time frame, individuals are asked to list their zip code of last permanent address. So this is really kind of summarizing that data based on that report out. We had 510 individuals during that 2-year time frame that we were able to analyze. There were others that didn't give their zip code, so we really can't capture the data for that. But of the folks that did give us a zip code, this is what we get.
Because they might not know it.
Well, I mean, they have to answer the question, and they have to give us a zip code. So I found one zip code in here that was not a zip code that came up as anywhere. So I had to kind of take that out, but unfortunately, there is some gaps with, folks reporting, but it does give us a good number. So of the 510 individuals that we were able to gather data for, 84% had a zip code last permanent address located in Cayuga County. And 13% had a zip code that was in New York State, but not in Cayuga County. And I broke down the specific counties that the folks recorded, a zip code for, the highest number of individuals outside of Cayuga County, but inside New York State was Onondaga County. And then there was a variety of other ones. And then 3%, 16 individuals had a zip code that they reported that was outside of New York State as their last permanent address. So when I took a look at what I had before for the 4 years, all of these measurements actually they shifted in a good way. We had there was 84% actually had a zip code of Cayuga County at this time. And last time it was only 76%.
76?
So it went from 76% up to 84% for the first measurement. And then this time we had 13% that were outside of Cayuga County. Last time we had 18%. And this time we had 3% that were outside of New York State. And the last time we had 6%. So some movement in those numbers. Definitely a larger capture of 4 years versus 2 years, but I think it's just interesting data to have.
Yeah, this is very, especially trying to be very careful, budget wise and stuff. So I'm trying not to sound stupid, but in my other county of origin, right, is where people, so if you're on public assistance, your county of origin pays. I guess what I'm getting at is, do these places have to reimburse Cayuga County at all, or anybody can come here and use our services?
So when somebody is homeless and they come here to Cayuga County, we always look to see if there's someplace else where they have a place that they can go. Do they have a residence that they can still go back to that's in another county? So off the bat,
Even if they're in this county, yes,
right, exactly. Same way. So sometimes people come in and we find out they actually do have a place that they could go to back in Onondaga County where they were, so they go there. So we're always trying to
where found.
Yeah.
The regulation is if you're homeless, it's where found provides for you,
Yeah.
not your county of origin.
Okay. But we still try to interview and try to figure out, is there any place else that they can go? That they had a place, were they renting a place?
Right.
Were they staying with somebody that just told them that they had to leave, but they actually have to go through the eviction process? So trying to really kind of slow it down and figure out, is there a place that this person can go? But Ian's right, that it is where found. So if somebody presents here as not having a place to live, it's our responsibility to screen them. And if they are eligible for the service of being provided housing, it's the county's obligation to provide that.
Do you have a sense why 40 people from Onondaga came here? Because do you have even a sense of that, why they didn't come to their own? Is there closer?
No, it's hard,
No.
I guess I
Yes.
can't like say in general
Yeah.
why. I think, that's the largest county that's right next to us.
Sure.
The other counties that are around us also were
Mhm.
the highest number of individuals from, it also goes the other way. And I actually didn't get the data to figure out from the, COC that says how people travel, because we have people, when I did this before, years ago, there were people that went from Cayuga and went to Onondaga,
Mhm.
so, it kind of goes both ways. And a lot of it is based on the counties that are on your perimeter, that are real close. I thought that this was,
No, because there was
valuable
a,
information.
used to be a sense that we served, most of the people that we served. there.
Right.
Yep.
So
84% is a good number, yeah. Mike?
So I guess my question is it the services that we offer to the homeless? Is that the same services that Onondaga or any other county, is it standardized from the state? Or is it, handing out bath towels and everybody else is getting a dishcloth? I mean, I know that's a crazy, analysis.
I like it though.
That's fair if we're really good at what we do.
Yeah, I mean, I think everybody's screening process is supposed to be the same. The standards are the same around, your eligibility for the services when you're coming in saying you're homeless and need a place to be housed. Every county is a little different in what they offer as far as the, I guess, accommodations, if you want to call them that. Like some places only have, a shelter. Some places don't have any shelters. Some places have shelters like we do. And we also, don't have enough beds in shelter, so we have to offer the alternative of hotels. Some places that have warming centers, we don't have a warming center. So it really does vary based on what you have in your county as far as resources, homeless shelters, what you can utilize for the additional around hotel placements. We're obligated to meet the needs of the folks that are here, that are eligible for housing here within Cayuga County. So, that's why we have a small number of shelter beds and a lot of people right now in hotels.
The Code Blue, we've probably been under for the last month and a half.
Since October.
So is that because we don't have a warming center? So we're
No.
in hotel rooms, is that?
No, so Code Blue is really about the obligation for the department to make arrangements for housing for folks when the temperature is under 32 with the wind chill, during, any point of the year. So it falls usually October through March.
But if we had a warming center, they could go there instead of hotels or no?
If we had a warming center.
Right, that's what you were asking, right?
So if we don't have a warming center.
Right.
They're going into a hotel.
When we talked about warming centers and the costs associated with warming centers, there's a huge administrative cost to that, to run that, to staff that, to have security,
You did look at that to see if that would be a more cost-effective way.
Can people sleep in a warming center too? Is it the same?
It's not supposed to be like accommodations like a bed and a pillow.
So you would still have to offer additional
Warming
housing.
centers are for a period of time during the day, not for 24/7 like a hotel room is.
Right.
Somebody
So it
has.
wouldn't replace something else.
Yep, for an evening, or from like 8 PM until 8 AM, and then they're turned out. And so then where do they go? They go back out onto the streets and they have to find someplace to go for the daytime. During this really very, very cold weather, I know Onondaga County, there was an article in the paper, I don't know if anybody read it, on the media that talked about how they were accommodating that. And they opened up different buildings like during the day because they do have warming centers. They also have a number of shelters, and all of them, I actually talked with someone today and found out that they're all over capacity. Their numbers are very high, just like ours are. I was going to give you a snapshot of what our numbers look like right now. And they've been climbing. We have singles right now, 148 singles are being provided as of last Friday. Being provided, housing because they don't have they're unhoused, and families are 31. So if you remember back fall, I was talking about being in the 80s. We've gone from the 80s up to now. We've been climbing up and we're at 148. So we're really high. Our code blue numbers right now that we're housing is somewhere like around 20. So 20, a little bit higher than 20, a little bit lower than 20, but it's 20 and that is high. Like we don't usually see 20 people being sheltered through code blue here in Cayuga County. So this is a year that our numbers have gone way up and
Are you still able to stay under the code blue allocation or who knows?
we'll
Yeah.
see. I don't know.
Because
I don't know if
the
we will.
state funds code blue 100%. But
I want to be clear, that your comment, Elaine, is that obviously if we were to have one of some sort, it would be more costly to maintain staff.
yes, we were shocked how expensive it
Just put
was.
somebody in a hotel. The cost is, it's definitely a difference.
Yep.
Interesting.
Mm-hmm. I can't remember what you had said before Mark talked. I was gonna say something. I can't remember.
Sorry.
That's okay. That's all right.
You said 100% is funded.
Oh, yeah. So-
Are you staying in your
So we talked
allocation?
about that today, actually, and I don't know. I mean, with the spike in code blue, I don't know if we're gonna run through our money. Last year when we did go over, we did get additional funds. We showed them our costs and we were able to capture more funding to cover it. We will try if we do run over to do that again. I'm hopeful we'll get that money and maybe they'll see through this 2026 year that we actually do need more of an allocation for code blue than we've been getting. So that's where we are right now. So we're very busy on the, temporary assistance intake side and the homeless unit because of these numbers and what's been happening with the cold weather. I know that the official information is not out yet about the HUD's point in time count. That date was actually not in January this year. It was at the beginning of February. It was last Wednesday. And from a couple of people that I talked to, it's my understanding that, again, not officially, but there were 2 individuals that the teams went out, found 2 individuals that were actually living outside at that time when they saw them. They also capture information about how many are in shelter, how many that we're housing through the hotel placements, and that'll all come out much later. But that night when they went out to do the count, there were 2 individuals.
And they found more prior to that? And when they
We don't usually have a lot.
Okay.
But and it was very cold.
Yeah.
I mean, there were 2 people out there.
I can imagine how they're doing it.
Yeah. So that was the first sheet that I gave you. The next form is kind of a summary of information that I was able to get from a December 2025 report out of OTVA. So I took information that was on this very large report and kind of synthesized it down to give you some information about where things look with temporary assistance expenditures for 2025 versus 2024, and a little bit of information underneath that about kind of what the breakdown was of the number of folks that were receiving those benefits. I'm not going to really run through that because there's a lot of information on here, but look it over. If you have any questions, let me know. There's information also about SNAP expenditures and how those compared from 2024 to 2025. And then on the backside, there's also some information that's interesting about how many recipients in Cayuga County received Social Security income.
When's the work requirement come in play for
So
SNAP?
we're doing our last round of workshops, really, like where people come in and learn what they need to do. They're the able-bodied adults without dependents, those. So in February, we're having another session where people will come in and learn all about what they need to do. The first month that starts to count towards the 3-month that they have to, if they don't do things for 3 months, which could be March, April, and May, they'll start to not receive the benefit.
They have to look for work and do.
Yeah, if they have 3 months where they don't qualify, then they can be with the benefit. So starting in June is when we will have, we can.
Changes in caseload
Yeah.
from that,
Yeah.
if that's gonna
Yeah, and
happen.
what that impact's gonna look like, I don't know. But I believe that there will be a significant number that are not in compliance. So that could actually change this number on here for SNAP as far as expenditures for 2026. We start to see a lot of people fall off because they're not meeting the requirements for the
And there'll still be a number of individuals who are not considered able-bodied, have an exemption with a disability
Yep,
or,
medical.
and they would be
Yep.
exempt from this. But if you don't have an exemption, you're going to be required
required,
to
yep.
look for work and get a job.
Or do a training program.
Yep.
Yeah. So that's coming into play very soon. The next paper is the same thing that I gave out before, which is the foster care and care detail report. I just gave it to you again because I think, because we talk about foster care so much and how costly it can be. I wanted you to see the numbers, what they're looking like. I pulled this today. Right now, we have 81 children in foster care and have 7 in institutions. So again, staying with the positive news that I said last time about our institutional placements seem to be going down. This is another month that they're staying down, so that's good.
Yep.
The graph on the back just again is just an indicator of like we've been trending down with the number of children in foster care and we're continuing to see that.
Great.
And then I just wanted to touch on this quickly, a little bit about adult protective services. We have seen increase in adult protective services referrals over the year, over the last year. What I gave you is a graph of the number of referrals we received over the last 13 months and also the age group of the individuals that were receiving referrals on. And if you look at the chart that's at the bottom of this, it talks about each month, starting in January of 25 on the second page, all the way up to current, like what our referrals are looking like. And you can see that we were down in the 20s and 19, 22, 23, and we're trending right now at about 34, 32, 35, 136 referrals. So it's a lot. The workers have a lot of cases. There's a lot of assessments, a lot in assessment stage because we're getting referrals fast and furious. And you can see that we got 15 referrals just in the first 11 days of this month. So
Does this have anything to do with you don't have agencies doing the representative payees anymore? Or these are just straight cases where there's risk about girls because of adults at risk?
we actually, a little bit of both, I think.
Okay.
So they're, Helio Health, who had been doing some rep pay, work with individuals in Cayuga County are no longer doing that. So if somebody needs a representative payee, we are the agency of default.
And they have to open an adult protective case
Yep,
for
and you have
this.
to open it. But I wouldn't say that that's like the huge spike.
Mhm.
You can see that a lot of it is, we have a lot of, folks that are between the ages of 70 and 90 plus. I mean, I think I added those up and I think it was like 180,
Mhm.
almost, yeah, 180 of them, that were referred, over the last year are, between 70 and whatever, above 90. A lot of health needs, a lot of, care needs, medical problems, that they need help kind of navigating where to go for services and supports. Brenda's nodding her head, and all of that. So, definitely impacting us on the DSS side. I know that Brenda's talked a lot about that and her reports and their work, but, comparable really in our adult services area.
I can remember Beth DeShaw years ago saying that individuals who come in, even if it's not in their best interest to stay at home and to try to maneuver through it, people make their own decisions and sometimes they're difficult and, people have the right to decide how they want to live. And your job, I guess, is, if they're competent, is to try to support them.
Try to support them and try to find services that can help them.
Yep.
With, what they are choosing to do. There is a large number also that need help getting to the next. So like
Yep.
helping them, kind of figure out like, what do you do if you need to have a higher level of care? Where do you go? We're helping them get information.
No,
Yeah.
so there's a lot of work in that area. There we go. I think I touched on all of
Thank you.
the topics that I wanted to have.
If you want to move into your resolution.
Unless you have any questions on.
No, it was just process, there was a lot. HH6, authorizing the Commissioner of Social Services to enter into an agreement with Q-Track to provide virtual queuing and appointment solution for GSS. Or can we get a motion for discussion?
I'll move that.
Second.
Nothing new, right? You've had this?
No, so this is our computer system we have in place that helps us with moving folks that come into DSS through the queue to be served, to have someone talk to them and figure out, what assistance they need. We did work with our IT to, kind of navigate. This is our best option. Again, it has gone up significantly. It was $5,313 in 2025, went up to $7,082.
They raised their rate or it's because of the amount you're using it?
They raised their rates.
So it's a fixed rate though that we're budgeted for?
Mhm.
You need this to operate?
This really helps move people through efficiently. It's about confidentiality because you're not like shouting out people's names. They have a number that they're assigned. We ask them to come back up based on their number. It definitely helps us with just managing the flow and getting them to the right person to have a conversation with them about what brings them to DSS.
All in favor?
Right.
HH7, authorizing the chair and the Commissioner of Social Services to renew the contract with Community Action Programs Cayuga Seneca for the provision of non-residential domestic violence services.
I'll move that.
Second.
I've said my understanding is if we didn't have a contract for this work, you would have to hire staff and do it internally.
Yeah.
It's not, it's not optional.
Right, so this is we're required to provide the non-residential domestic violence services to folks in Cayuga County. And really what it consists of is get, information referral. So you people, get referred to the agency to have a conversation about, domestic violence. They provide advocacy to individuals, counseling, community outreach, and hotline services.
And that's a fixed anticipated cost too, right?
Yep.
Does make sense.
Yeah, so it was 133,200 and it's about a 5% increase. Staffing increases, utility increases, all of the things that everyone's challenged by. So the amount that we spend on this, we can receive 50% reimbursement from New York State because it's in our consolidated services plan. Once our Title 20 funds are exhausted, then it falls under being able to be reimbursed.
Not unlike the other contracts you're looking at. Will this get RFP'd at some point or?
Yeah, so this resolution for this contract and the next resolution are on the list for.
Here?
Yeah.
All in favor?
Aye.
Carried. And last one, HH8, authorizing the legislature and the Commissioner of Social Services to enter in a contract with Children's Home of Wyoming Conference for the recruitment, training, and retention of foster parents.
Move it.
Second. And so this one also has a not to exceed of 191,000.
Correct. So this, we've had the contract with Children's Home of Wyoming Conference for a couple of years after we went through an RFP process. And chose them. We're gonna be going through our process again to for the 2027 services for the same services. This is a little bit, not a little bit, this is less money than it was last year because we ended up deciding that we were going to cut back from 3 staff to 2. We had 2 foster care family specialists and 1 other family support worker that really worked primarily with the foster parents. And
Just due to budget constraints and trying to, take a look at what we could do, we ended up cutting it back to being the 2 staff. So it's the 2 foster care family specialists. It decreased it from 236,522 down to the 191,988.
Decrease.
Yep. So, and again, this is, we get a minimum of 50% reimbursement for this contract.
Your motion second, you did? Yeah.
All in favor?
Aye.
Great, thank you. Brenda, Office of Aging. No resolutions today, but you did provide us a report.
Right.
Do you have any highlights you want to share? I was curious too with you said you sent out the letter of how many people received this. What is that difference from last year?
Well, it's a little bit higher. I think $1,000 to $1,500 higher.
Meals, you mean? Is that
Mhm.
what you mean?
Yeah, the volume.
And you had basically said that's out for RFP. If a new vendor is awarded, you'll bring something to Ways and Means just so that you can get things in motion. If not, you'll wait till next month. Is that
That is for the
meals? Oh,
emergency response pendants.
okay,
Oh,
not
right.
for the meals.
Right.
Okay,
Right.
okay. That would be like the Link to Life and PERS. Okay, all right. Mayor.
This time of year, we kind of focus on training. There's less people on vacation and we're not doing our outreach as much and such. So we're focused more on in-house training. I was just texting adult protective supervisor because we frequently will get together with them and talk about services and how we work together. I just want to build on what Christine was saying. There's hardly a week that goes by that we don't have 1 or 2 situations that we look at to really debate whether or not it rises to the level of adult protective or is something our case managers can do. And, we try very hard to do it as a case management or a New York Connect situation as much as possible. So, but it is harder, the families just aren't there. There's more, alcohol, substance abuse, mental health issues, those things contribute to family dynamics. And sometimes our older adults get caught in the middle of that. And I think it's just more of a challenge with all the aging of the population. We're just seeing more and more of those situations. So we've always had a really strong working relationship with adult protective and that when we have our in-services, that just helps our staff get together face to face and kind of hear what each other does, what we can and can't do, especially for the newer staff, because we do have kind of different and separate roles as to what we can do. So that's it. I don't have any other questions. I'm still trying to get a junior accountant. I will share that we did have a couple of people turn it down because of the pay. They were coming from 2 other counties. So that was disappointing. So I wanted to share that.
They said they turned it down because of did they say what they were looking for?
These are union jobs too, right? Are they junior accountants in the union?
Yes, they are.
Were we way away from it or?
10 to 15,000 below what they're currently making. Yeah. I can't say that either of them were at a junior accountant. It wouldn't have been a lateral transfer. So there is that. They were doing slightly different jobs, but thought that it would be comparable. So we keep looking, we keep getting applicants, so we'll keep working on that. And then I just want to point out here that it's kind of stuck in the middle. NYSOFA does do audits of all the work that we do. NYSOFA, New York State Office for the Aging. So this year they are doing a desk audit. So we have to send them volumes of paperwork, scan it and send it to them regarding our caregiver services program and our transportation services. So that will be all due to them by February 17th, and then there'll be a follow-up meeting to go over all that. That's everything from our policies and procedures to our audits, to our internal audits, our satisfaction surveys, our billing process, our policies and procedures. You know, it's a full gamut of everything. And they're just highlighting these two particular programs this time, caregiver services and transportation. And then in June, there will be the regular recurring audit of the nutrition program. And that is a 2-day in-person audit when the dietitian from New York State Office for the Aging comes out. Visits the main kitchen in Rochester, visits our site, does a meal route, looks through all our documentation. So those things will be coming up. That's one of the things we're working on. Thank you. Yep. Thank you.
Thank you, Brenda. Thank you. And Deborah Dennis, we don't have any resolutions. Do you have any updates?
Some updates. It's sometimes easier to talk through that. I wanted to start with something that's not directly Youth Bureau related, but it was something that I was asked to oversee. And that's the New York 250th funding that the county will be receiving. You may have seen in the past couple of weeks in the paper that the city of Auburn has 20 events and exhibits that will be going on. That's just so you know, that's not the money that the county received. That's money that the city of Auburn provided for those events to take place. So the money that we'll be receiving $15,000 to do programming throughout the county. And that's what we're really trying to focus on, is doing things outside of just the city of Auburn. I have 4,
What's the purpose? To
just
educate and
to celebrate
Celebrate.
the 250th birthday of America. So they're just trying to have everybody kind of put ideas and creative ideas together to celebrate the revolution. And there's pretty wide latitude of how the funding can be spent. I know I have other applications from those that I have met with and spoken with about this, but just some of what I've received is something from the Seward House for actually really, it's not, they're hosting this event, but there's actually a history day in New York State where students from Moravia and now Cato are participating in. The history day is to inspire pride of place of local students, and it has a Celebrated America 250 theme. So the Seward House is actually going to be hosting that competition at their location in March. And so they're looking for some funding to kind of go along with that day for awards for some of the students. I received a nice application from the Old Men's Heritage Center for some different activities at the Port Byron Library, the Heritage Center, tea at a local church, a reader group, and soap making at the Port Byron Library for activities raising awareness of women who aided the Revolutionary War. And another with a hands-on history camp that's going to have a focus on Cayuga County's exploring Cayuga County's Revolutionary War history. So sponsorships for children to attend that camp. So that's just some of what I've received for that. And then going on to some Youth Bureau things, I just like to kind of share some of the things that I know the Youth Bureau funding is aiding in, because I think a lot of these programs are doing a great job. The Montezuma for the month of February, their youth programs, I think I've mentioned before, but they have a free ice skating at Casey Park next week. They're going to the Rochester Science Planetarium, doing discounted crunch tickets. And starting February 27th, they're going to be offering swim lessons at the Y for $7. So that's just something that the funding that the Youth Bureau provided has allowed those residents, those children in those communities to do. One thing, and you may be familiar with this, I'm not sure, but I've learned this through a meeting with the YMCA because we do some Youth Bureau activities there. And when I've met with the CEO, there is a program in conjunction with BOCES that students enrolled in the Auburn School District are allowed a very significant decrease on their Y membership. Just to give you a perspective, my son is an individual member of the Y. He pays $27 a month for him to join the Y. If he were to go to Auburn, he would only have to pay $6.50.
because of the poverty level.
It's not just the poverty, actually. I've learned more about it. This is actually a program through Cayuga Onondaga BOCES that all school districts are eligible to participate in. It's of no cost to the school. So right now I'm trying to get into the schools and
encourage them
about
to participate
to look into it. I know that the CEO, he has had trouble getting other schools to reach out. He's explained to me the process. There is no cost to it. So I'm working with specifically right now Weed Sport, just because as a parent and the youth PR director, that's kind of how I got my way in to try to support this and try to get them to help me if they adopt it, work with other schools to show that they can do this as well, because there is no cost. And I think that's what the districts think. This is going to cost us money, but it doesn't.
And not, this sounds awful, but what's in it for the why? Just reaching out to youth and.
I think reaching out to youth and getting the youth to participate. I know in the Auburn School District, the athletic director, he's really, the membership has gone up. The state's reimbursing a lot of the costs, so the Y is not losing money and they're getting more participants. And it's not just the Y membership. I mean, it's for K through 12th grade. And if you have 2 students in the district, you actually get a family membership. So your whole family could go to that. And that would be, I think that's about $23 a month. So it's a significant savings. And there's camps and other activities, not just the actual fitness center itself. So that's one thing I'm working on. And then with some of the ARPA programs that are still going on, I'll send everybody information once I have the details, but March 12th, again, at BOCES, there's going to be the Food Systems Care Career Day at BOCES that the Growing Hope Cayuga puts on. And this will be the 3rd year they've done that. And that's a really interesting event. It's a no-cost event. It's geared towards the youth grades 8 through 12 and youth educators. You can learn more about the ag and food industry careers here in Cayuga County and the region. So that's coming up March 12th. The Hideout continues to do different virtual reality, PS5, Xbox, retro games, board games. They have tournaments, a 2-for-1 on Valentine's Day. They offer birthday parties. So they're doing really well.
Great.
And Cayuga Counseling. So they have their youth days once a week. They have a youth club for 9 and under and 10 and up. And they have a lot of different activities going on. Like, for example, February, they had a sensory night, baking and decorating cookies, game night. This all takes place. You have to pre-register on the first floor of their center. And on February 20th, they're doing a free bowling event from 4 to 6 at Rainbow Lanes and Weed Sport.
Great.
So that's just some activities going on and just try to work with other, just kind of try to spread the word of a lot of things going on the best I can, especially with breaks and whatnot coming up, things for people to do, because I know a lot of times the complaint seems to be there's nothing for kids to do, but really if you look into it, there is. So I like to try to at least educate people as much as I can on that. So that's all I have right now. Does anybody have any questions?
For that 15,000, do you think you'll do more of the rural areas of the county?
That's what we want. I know when I had initially spoke with Chairman Anna about that, that's what we kind of want to focus on because the city of Auburn has so much of it. I've been working with Ruth Bradley, our county historian, on some ideas, and she has shared a list with me of contacts that she has throughout the county that I've been in touch with. And there's different things, like I know the New York State Canal Center, they're looking to do bring a noted historian in, so they can pay for travel expenses for this person to come from Vermont to do a speech. And he's actually going to talk about the Revolutionary warship, the Spitfire, that is at the bottom of Lake Champlain right now. So when I reached out to the state, I wasn't sure if there was anything that you couldn't, like, can you do travel? Can you do speakers? And they said, we have a pretty wide latitude. So once we get all the applications and Chairman Ann and I can look them over and kind of see what the next steps are. But we have 15,000. The money I've been requested so far, it's usually like 500 to 1,000 requests. They're not huge requests. So if we can get more in, I think we'll really be able to spread it out and do a good job with it.
Great. Thank you.
Thank you. It's all of it unless you want us to keep going. All right, can I get a motion to adjourn?
Second.
All in favor? Thank you.